4 a.m., you have a patient who's just come in on a trauma. You have an issue with trying to keep their blood pressure up, and you feel like they really need a lot of fluids. You know that that's the piece that you have to go with. You have the ability to get those orders immediately. You're able to call on them and say, this is what I need. Today things get so busy, our patients are so sick, they're so much sicker than they were even 10 years ago, 15 years ago, but people are able to survive better. They're able to go to their children's graduations, they're able to see their grandchildren born.
Almost 3.5 years ago, my colleagues and I got together to talk about how we could enhance patient safety in our intensive care units.
Maryland eCare is a revolutionary telemedicine technology that complements in-hospital nurses and doctors to monitor critically ill patients in intensive care units. Using state-of-the-art cameras, secure high-speed data lines, and other instruments, ICU patients are remotely monitored by a team of critical care nurses and physicians.
eCare is an eICU that helps to bring technology and human experts together, coupled with the experts that work at the bedside to bring critical care, a complex environment, into a realm where everyone can work together with a focus on the patient, on quality of care, safety of care.
We're constantly striving to improve patient care. The eICU program is going to be a big benefit for our hospital and our community. We're a community hospital, and we're not unlike any community hospital in the nation where resources, staffing, what have you, are precious commodities and sometimes beyond the reach of a community hospital. The eICU will be a great benefit that will allow us access to critical care intensivists to be able to make critical decisions in a timely fashion, the key being for a good outcome for our patient.
Christiana Care Health System in Wilmington, Delaware will monitor Maryland eCare patients.
I've been running ICUs in some form or another for over 25 years. There have been dramatic changes in ICU. Most of the stuff we did even 10 years ago is obsolete now. As technology becomes available, we're constantly changing. It's a very dynamic situation. The eCare program here at Christiana Care has been up for 3 years. We monitor over 60 beds in 2 hospital sites, multiple ICUs. And it's been a very successful program.
The computer system that has the physiological vital signs stream through it allows us to see trends in patients. So in a remote location, using the computer system, the technology, we can see those trends a lot faster and get the patient what they need.
We have wonderful monitoring systems and processes in place. We are very, very safety conscious when it comes to our processes and the care that we deliver. With the eICU, 150 miles away, there's a whole group of people that are also watching that patient with you, that extra pair of eyes, and looking at all of the patient's parameters, not just 1 or 2 things.
We have an excellent nursing staff. We also have excellent physicians that support us. But it is nice to know that the eICU is right there with us at all times, 24/7, helping us to monitor more efficiently and more safely.
We recently had a medical resident who was critically ill in our intensive care unit, and this was an individual who had utilized eCare from a resident perspective, but now was the patient in the bed, and she got to see it from a whole different angle.
I am a 3rd-year internal medicine resident here at Christiana Care. A couple weeks ago, I'd had fevers and chills, and about 36 hours into being ill, I decided to come to the hospital after I apparently passed out. And upon being admitted to the hospital, my blood pressure dropped very low, and my heart was going very fast. And the first time that Dr. Zubrow chimed in, the idea that instantly I was talking to an intensivist who was changing my care plan as we were talking was invaluable as a patient to feel that to give me that comfort that I could get better, that I could make it to the next morning when that wasn't necessarily the feeling in the room.
We definitely developed a good bond through the night, and fortunately she did very well. But it was a unique experience where a young physician gets to see the healthcare system from the other side.
I think it's an amazing tool for the healthcare industry. There are times where you need to be in sometimes 5 places at once, and it's virtually impossible. And in order to give the best healthcare and to give the patient the best benefit of getting better, having an electronic ICU is an amazing alternative.
Several community hospitals are participating in the Maryland eCare initiative. These hospitals are on the front line of quality community care, each providing the best in ICU services to Marylanders.
There's simply not enough of us to be able to kind of provide 24/7 coverage to the ICU on site. And having eCare fills in a big part of that, because the patients don't suddenly become not critically ill, when we're off site.
I have always felt that I've given good patient care and pride myself in that, and I have always used the resources available to me at the hospital to make sure that I'm giving very good care.
So I essentially think eCare does exactly what it was originally conceived to do. It leverages the coverage of the existing intensivist. It increases it, and it's a resource for the nurses.
I'm going to be able to give constant care at the highest level possible. If I could bring anything back to St. Mary's, I think that they should rest assured that we are getting excellent care, and we're having this wonderful opportunity that we're going to be able to take advantage of this.
This will improve patient care. People are being watched by board-certified intensive care physicians within our intensive care unit.
I think it's very important for every facility in the country to look at their institution, their facility, to see how they can improve the quality of care for their patients. I believe that eICU care will be able to provide that for us.
Amazingly, the patients and the family members really did bond with every bit as much bonding with their bedside practitioners, but also with the people that were monitoring them remotely. It gave them an added sense of security.
I've seen the benefits to the critical care nurses where they don't feel as stressed because they know they don't have to go look for somebody to come help validate them, or they don't have to wait for somebody to walk in the door to help them out and get orders from them or anything like that.
With funding from Care First, Maryland eCare unites hospitals and insurers in improving care for patients.
This collaboration with the Maryland hospitals is unique in the first situation like it in the country, where a third-party payer is financially supporting the collaboration between the eICU here in Delaware and the rural hospitals in Maryland.
We were able to secure a $3 million grant to help offset the capital costs. In addition, there are operating costs, and that's where we lease the eICU remote location from Christiana Care.
We clearly believe this is the care model of the future for the entire country. There are just not enough intensivists, and hospitals of smaller size just cannot provide the level of support, attract physicians to provide this level of support without this type of outside assistance.
And so it's a well thought out plan, and we're very excited to be able to offer this service to our patients, and we expect that the quality of care will even actually be superior to the care that we're providing today with this technology.